Now, I'm very pleased to ask Mr John Burns, Chief Executive of NHS Ayrshire and Arran, to officially introduce the event. Thank you.
Thank you, Jean. Good morning, everyone, and welcome to this event. I think it's excellent that we're creating some space and time to have this discussion, to share learning, to understand and challenge some of the new ways of thinking and to celebrate success. So I very much welcome these opportunities. I think that we all know that services are facing many challenges, some about increasing demand, some very new challenges in the population. And I think that how we respond to those challenges will determine how we deliver our services in the years ahead. And I think that through the work that we've seen in the Change Fund, the different ways in which we've tested new thinking, that by challenging some of the status quo, we will start to find innovative ways that will respond to those challenges over time. The work that you and many have been doing as part of the Change Fund and Reshaping Care for older people, I think is at the forefront of that innovation. For me, there comes a time where we have to make sure we are truly learning from that innovation and that we are starting to spread what works. That means making some difficult decisions, perhaps, in terms of investment, in terms of prioritization, in terms of how we develop the workforce and how we work with our communities and those that use our services going forward. So it is challenging. It's actually quite difficult at times. But I think that as long as we are willing to openly discuss those challenges, to look at new ways of learning, to explore new thinking, and that's what today's event will help do, then we will continue to move forward. We will continue to deliver high quality, person-centred services to those in our communities. Of course, it's not about any one organisation or one part of our communities doing this in isolation. I've been in Ayrshire and Arran now for probably around 18 months, and I've been very impressed by the partnership working that takes place across Ayrshire. And that's an important aspect on which we will build the future. Strong partnership working, not just partnership working between the health service and local authorities, but genuine partnership working with third sector, with our communities, with those that use our services. That's how we will take forward the services of the future, to build on that strength. And with integration, the integration of health and social care, the partnership working we have here is a solid foundation to go into that integrated way of working and to build forward and to work with our communities, to build on the core idea of locality planning and the role of communities, the role of professionals in working to build those locality plans and to deliver services in the future. So we talk about working together. I think that in the room today we have a very good example of how we work together, how we share together, and how we will develop and change the way we deliver services together. One of the things that I think is important to acknowledge is that we are working in a very fast changing environment. That means that we've got to respond to that, which is why I do believe that from events like today, the momentum that you come into the room with, as has been said, this event was oversubscribed, and so we're filming it so that as many as possible can share what you will share today in discussion, in challenge, in learning, and in celebrating those successes. But we do need to start to make those decisions, and we do need to start to accelerate that pace of change in order to look across all of our services and manage those future demands differently. I want to acknowledge the hard work, the commitment. Change isn't easy. Taking forward change isn't easy. stepping up to that plate and saying, I want to be part of something different, I want to try something different, challenging some of our traditional or conventional ways of thinking around services, engaging people in different ways, breaking down old-fashioned barriers isn't easy. But by the work that you're doing and many others are doing, in committing to this change programme, committing to look at how we deliver care for older people across our area, then I want to thank you for that and to encourage you to do more. Because it's that sense of purpose and value that you bring to this discussion, that you bring to the way that we will look at services, is fundamental to the future. You are challenging the status quo, and I welcome that. So, thank you for listening to those few words. It's been my pleasure to have this opportunity to take the short welcome address for you. I hope you have, well, I know you will have a really enjoyable day. You will get a lot from this. I encourage you to challenge, to question, to be inquiring of mind in terms of what's happening, and to share good practice, celebrate success, and build for the future. Thank you very much.